I knew I wanted to do something related to the medical field, as I plan on pursuing a major in biological sciences at UMD. At the start of this year, I had braces for almost 2 years and have dealt with their drawbacks. I was initially supposed to have them taken off a couple months back during the summer. However, due to schedule conflicts, my braces were removed 6 months later of February of this year. As you might have assumed, I was in no way delighted to have my expected due date of removal half a year late. The drawbacks I experienced from my braces pervaded through my everyday life, as I had to always clean my braces with interdental brushes after every meal and consistently check if there was food stuck between my brackets. Not to mention the fact that they don't look aesthetically pleasing to the eye. This led me to the idea of possibly finding a way to speed up the process on the duration of teeth alignment. My research delves into how accelerated orthodontics can be a way to alleviate the inconveniences of normal braces, aiming to hopefully have new techniques become implemented to a wider audience. Overall, my research elucidates the answer to the following question: what techniques are effective in speeding up the process of tooth alignment, and what are their potential implications for the future of orthodontia? Essentially, how can we ditch braces and replace them with better methods to be put out to the world? The first of 3 techniques I would like to talk about is photobiomodulation, also known as low-level laser therapy, which represents a groundbreaking advancement in the realm of accelerated orthodontics. By utilizing non-ionizing forms of light sources, including lasers and LEDs, this technique harnesses the power of light to stimulate cellular activity, particularly in tissue surrounding tooth roots. A 2013 study demonstrated that photobiomodulation can expedite tooth movement significantly during the alignment phase of orthodontic treatment, with rates of tooth movement reported to be over twice as fast compared to conventional methods. Photobiomodulation holds immense promise for reducing treatment durations and enhancing patient satisfaction. While further research is essential to fully understand its long-term effects and optical application methods, the preliminary results suggest that photobiomodulation could be a great method for accelerating the tooth movement process. The second technique includes lasers, which is an acronym for light amplification by stimulated emission of radiation. And this technique has emerged as another potent tool in the arsenal of accelerated orthodontics. The focused, narrow beam of light generated by lasers can be precisely targeted to facilitate specific orthodontic procedures, such as distalization, which is basically gaining space by moving the front teeth apart. Research has shown that there's a significant increase in the rate of distalization on dogs when using laser technology compared to traditional methods. This advancement suggests that laser techniques could be instrumental in hastening tooth movement and potentially reducing overall treatment times. However, it's crucial to note that while the results from animal studies are promising, further investigations on human subjects are imperative to ascertain the safety and efficacy of laser-assisted orthodontic procedures. Despite these challenges, laser techniques present a promising avenue for accelerated orthodontic treatments and improving patient outcomes. The third and final method is mechanical and surgical techniques. These techniques include corticotomy, piezosurgery, and micro-osteoperforation, offering innovative approaches to expedite orthodontic tooth movement. A 2016 study showed the potential of corticotomy by significantly reducing treatment durations by accelerating tooth movement. Similarly, micro-osteoperforation has shown promise in enhancing tooth movement rates, even though there are varying results across studies. These techniques work by modifying the surrounding bone and tissues to facilitate faster tooth alignment, addressing one of the primary concerns associated with traditional orthodontic treatments: prolonged treatment durations. While these mechanical and surgical methods offer exciting possibilities for improving the efficacy of orthodontic care, their widespread adoption necessitates further research to ensure their safety, efficacy, and long-term effects. Nevertheless, these techniques signify a transformative shift in orthodontic practices, paving the way for more patient-friendly and time-efficient treatment options in the future. Now for my methodology. Through an insightful interview with Dr. Natalia Timona, a board-certified orthodontist, and a comprehensive review of exclusive articles, I gathered valuable research on accelerated orthodontics to address the question of effective techniques in speeding up tooth alignment and their potential implications for the future of orthodontia. Here's a portion of my interview with her after I got my braces removed.
My second question was when I was researching about orthodontics. I realized the braces I had before were known as self-ligating.
Right.
So when I was given the option, like you gave off like little trays of just like traditional braces with like the elastics, self-ligating, and I think there was one like clear. I was just wondering like how you came up to those like preferences to give to individuals looking for braces.
Yes, so in terms of braces, yeah, we offer traditional braces that they've been around for like 100 years. But then we offer the self-ligating that is a little more modern technology. In self-ligating brackets, they don't require elastics around the brackets, so it makes them cleaner for the patient to keep them clean, since the more you put on the mouth, the more food gets stuck, so it's more difficult to clean. The idea with the self-ligating is one of the reasons is it's easy to clean, to maintain, since there are no elastics required. Just it works as a door to close and to open the bracket, as a door system. And also, there's no much friction. When you put an elastic around the wire to hold the wire, you put the elastic around the brackets, it creates a little more friction, so that this they move slowly. But if there's more freedom, there's no elastic around, the wire can move easily, then they move faster too.
Over the past 15 to 20 years, the orthodontic landscape has evolved, introducing renewable appliances like aligners and innovative braces options such as self-ligating braces, the type I had, which facilitate faster tooth movement by minimizing friction. The interview highlighted the challenges faced by researchers in implementing accelerated orthodontic techniques due to the extensive scientific research required to ensure global applicability. Furthermore, discussions on various methods, including corticotomy, piezosurgery, and low-level laser therapy, revealed the ongoing debates surrounding their efficacy, invasiveness, and post-operative discomfort. So what? Despite the promising advancements in accelerated orthodontics, it is essential to acknowledge that much research still needs to be conducted to ensure the safety, efficacy, and long-term effects of these innovative techniques. While preliminary research and results have been encouraging, rigorous clinical trials and comprehensive studies involving human subjects are imperative to validate these findings. Safety is the #1 priority. This means thorough research is crucial in establishing these accelerated orthodontic techniques as reliable and effective alternatives to traditional orthodontic treatments. To recap, innovations such as photobiomodulation, laser techniques, and mechanical and surgical methods offer the potential to shorten treatment durations, reduce discomfort, and enhance overall patient experience. In the future, the usage of interdental brushes after every meal and the stigma around braces may be reduced. With continued advancements and the eventual validations of these techniques, it is conceivable that they will eventually replace traditional braces, offering patients more convenient, efficient, and aesthetically pleasing orthodontic treatment options. And who doesn't want that? In short, trust the process, because in a couple years, these techniques can really make a difference in the world of orthodontia. Thank you.